Welcome to Rural Health Today, the next chapter of our preceding program, Rural Health Rising. I'm J.J. Hodshire, President and Chief Executive Officer of Hillsdale Hospital, and this is the podcast where we connect with you on what really matters in rural health today. I am thrilled to be in the studio with our very first guest on the launch of this podcast. Someone who is well-versed in rural health care, knowledgeable, and you're going to find that out throughout his interview with me today. It is my pleasure to have Alan Morgan, Chief Executive Officer of the National Rural Health Association, often referred to as NRHA. And if you're listening today, many of you have taken many conferences, programs where they've introduced members of NRHA. Today, we get to talk with the Chief Executive Officer, setting the direction for what their organization is doing to support organizations like Hillsdale Hospital and others who are listening throughout this country. So, Alan, first of all, welcome to our program today. It is so exciting to have you as our inaugural guest and really to talk about all things rural healthcare. So first of all, welcome. It's great to have you here.
JJ, I appreciate the opportunity to join you today. What a great opportunity for me to kick this off with you and
Absolutely.
Talking about my favorite topic, which is rural health.
Yes. And so for those listeners who may not know a little bit, about what NRHA does or yourself, I want to start with you first. I'd like to talk just a little bit about what is your background and really what motivates you to do what you do every day.
Oh, yeah, I'd love to start with that because, JJ, I'm the fifth generation to be born and raised in a small farming town in northeast Kansas.
Oh, nice.
And so that's my background. Came out to Washington, D.C., and I've been trapped in Washington, D.C. for the last 30 years. But now this is important. This is the exciting news that I hopefully shares a little insight on me. Last summer, my wife and I had enough, and so we purchased a small farmhouse about 2 hours outside of D.C. I promised her that I would never complain about the 2-hour commute if she would let me get out of the city limits. And so far, I'm still sticking to that. We'll see how that holds.
We'll see how it holds, right?
Yeah.
That's quite the commute, it really is.
Yeah, but again, just being able to be where I enjoy being. And as we speak, my neighbor is actually plowing my back pasture. I'll be able to plant some corn and beans this summer. So we'll see. Again, it's just, I feel like now I'm back home, but I'm still working at NRHA.
It is truly rural, and that's what we talk about. And you're dealing with rural issues each and every day, most of them so impactful to what the work that we do here, decisions that are being made in Washington, D.C., and throughout the country, the respective states in the hospitals that exist in those states, decisions being made daily that impact the way that we do the work that we do. So before we get into a little bit more about your background, why don't you tell us a little bit about what you do at the NRHA? What does a CEO do? What is your primary responsibility, and what is the direction of the NRHA right now?
Yeah, well, let me start with this. If you care about rural America, there's a home for you in the National Rural Health Association. We're a membership organization, and we like to say that we're your voice louder. And what we do is we take our more than 22,000 members from across the U.S., and these are people that are community leaders, they're hospital CEOs, clinicians, again, anyone that's involved in rural healthcare. And we help bring their voices together, and we work with them to amplify that voice and to fight for high quality healthcare that's accessible for all rural Americans. And my job in particular just is making sure the trains run on time. We do education, we do networking, we do advocacy. We're going to talk about that today on this call. And hopefully, if I'm doing my job correctly, we are a unified voice for rural Americans to make sure, again, you have the healthcare that you deserve.
And Alan, you're doing a fantastic job, and I say that with all sincerity because when I look at organizations that help prop up healthcare in rural America specifically, because that's what I deal with, I look at our state association, Michigan Hospital Association. As a board member, I need to say that we're doing the best. But then what you do on a national level is in tandem with what we do at MHA. the work that you're doing at NRHA to have a laser focus on rural health in America is so critically important. I want to tell you, hats off to you and your team. I've interviewed several of them on my former podcast, and they've been a guest, and they talk really, about all of the challenges, but they do it in such a way that they make us feel encouraged in a very discouraging world right now. And they go and they're advocates for me. They're not just advocates for NRHA, but they're there to represent hospitals like mine. And so we have listeners from across the country that are listening to this podcast. I want you to know that, when NRHA lifts up their voice, they're lifting up your voice. And that's what's so important. So let's get into the heart of a couple issues.
Yeah, let's do it.
There's been some news recently of some national changes, and we say elections have consequences, and we're not going to get into party politics by any measure. But what we do want to talk about is that with every new administration brings new administrative, oversight and direction for our industry, and primarily because our industry is quite costly. And so, I guess if you could paint for us and our listeners the current legislative situation that we're in right now. And I want to start with something that's very concerning to us, Alan, and that's Medicaid. Medicaid accounts for a significant portion of my patient population right here in Hillsdale County. But that's rural America, right? So why don't you talk to us a little bit about that landscape, how that's really impacting communities like Hillsdale throughout this country, and what's going on at the national level to have this dialogue?
Well, you certainly are grabbing the bull by the horns to start this discussion off. And let me put a placeholder for our later on discussion, and that is the fact that rural hospitals face such tremendous challenge, and rural healthcare tremendous challenge. It forces innovation. And I love all the innovation that we're seeing in rural health. There's so many great stories, and the quality of care in rural hospitals are exceptional. We'll get back to that. So now let's get back to it. This is just, even before this legislative session began in D.C., rural hospitals, this is just a toxic, terrible time and an environment to operate in.
It is.
It really is.
Is.
We've got almost half the nation's rural hospitals are operating in the red.
In the red.
It's just an amazing fact. And so they're operating on small margins nationwide. But this is really important to this discussion we're having on Medicaid right now at the national level. The majority of rural hospitals that have closed over the last 15 years have closed in the Southeast, in communities where they have high percentage of low-income individuals with high health needs and the inability to pay for that health care.
Yes.
And we're forcing rural hospitals, rural clinicians to pick up the tab on that. Mm-hmm. Now we get into Medicaid. Why is it happening down there in particular? They haven't expanded the Medicaid program in a lot of these communities. And now we're talking about possibly cutting Medicaid nationwide.
Nationwide.
I spoke to the Washington Post this week and in the article, and they asked the question, well, how many rural hospitals will close if they actually proceed with this? I'm not sure the sun will come up tomorrow, but I am positive that there will be rural hospitals closing if they cut Medicaid.
There will be.
100%. And it's just because for rural hospitals, you have to have a good partnership with your local, state, and federal governments because of the population you serve. And
absolutely.
If one of those three legs, the local, the state, or the federal, backs off on their commitment, that's why we get these situations with rural hospitals closing.
Alan, so I'm following this very closely, obviously beyond the podcast. It's just my industry, and I need to look at it because it impacts my hospital. But, Becker's, I speak out at the Becker's Healthcare Conference several times a year. Scott Becker, a friend of mine, and he often will take a collection of articles. And one of the most recent article that was posted just this week was the projected number of hospital closures. And that number continues to climb. And what's really scary is looking at, and we don't have a crystal ball, but what we do know is, to your point, that if Medicaid cuts occur across the country, that there will be a tremendous amount of hospital closures. Of the 600 that they project, nearly half of them are at what they call immediate risk of closure, which means there's not enough cash on hand to survive the shortfall that Medicaid creates. And so what I want to talk a little bit about is kind of changing the narrative up a little bit. There seems to be a lot of push towards this idea of, going to the consumer and saying, you're going to lose your Medicaid. That's really not the case because the Medicaid product is going to be there, right, Alan?
Yeah, yeah, yeah.
The issue is the reimbursement to the hospitals and the providers,
100%.
correct?
Correct, 100%.
And
Yeah.
we survive on that. So go ahead and talk a little bit about that, your advocacy in that area of hospitals making a margin, not even making a margin, breaking even on that population.
Yeah, there's a lot of, we need to do a better job as an organization on communication on this because I think a lot of people don't recognize the amount of Medicaid that goes into maternity care as well too, and children.
Yeah.
That's a huge
Yes.
issue,
Huge.
especially for rural communities. And then on the back end of it, for those seniors that may be in nursing homes in rural communities as well too. So
Yeah.
it is a much bigger impact, than what people think. I will say this, and I'm encouraged because I just heard a Republican member from Texas saying we cannot cut Medicaid. It cannot
Yeah.
be on the table. This appears at this moment, I wish there was some wood here I can knock on. It is a bipartisan support for this, for Medicaid. And the
Yeah.
question is, how did they get there? They just passed a budget and they are projecting these enormous cuts to Medicaid, but yet Republicans, Democrats, and the administration say we're not going to touch it. Something doesn't add up here. So it's from a policy standpoint, it's going to be interesting
Yeah.
to see how this plays out.
Yeah, and one of the things that we're hearing right now, so we can talk about real events, is ridding the abuse, fraud, and waste that's occurring in programs like this. But what we have to be mindful of is that when we talk about the elimination of Medicaid as a program, we know that that's never going to go away.
Yeah.
What we're talking about is how the hospitals can serve this population with the uplift, whether it's the average commercial rate, whether it's a provider tax that comes in. That isn't government waste. Those are programs that exist in those respective states to help cover the shortfall of providing services to this population. And by the way, a population like in my county that almost exceeds 40%. And if you imagine that now you're going to take a major loss on that,
Yeah.
hospitals they will have to close. Or to your point, Alan, we're going to see what's happening across the landscape today, which I want to talk to you about. Obstetrics units are disappearing in our rural communities. This is becoming a major crisis in our country. And it's only going to intensify in communities and populations where Medicaid is predominant, and then that Medicaid funding gets cut and those programs go away. Talk to us a little bit about, you've worked around, the obstetrics challenges and OB access. You want to talk to us a little bit about that?
Oh, I'd love to. And I'd love to, again, here's another nonpartisan issue. Both Republicans, Democrats, both support, they understand the importance of this. But for a rural community, there are two segments of your community that you absolutely have to maintain care for. One, the seniors, to make sure they can stay in your communities as they age. And two, you have to have maternity care for those young families so they can come into your community and they can stay in your community. They are the future of the community, and you can't cut that off. And it's been such an enormous challenge of how do we deal with the clinician liability that they have to deal with on that, the continuing education for this as well too. And then when you throw on top of that some of these reimbursement rates, it makes it incredibly problematic.
Absolutely. Absolutely.
I like the federal government Office of Health Resources Services Administration has put out some amazing grants to try to look at innovative approaches of how can hospitals link up and network to be able to ensure this access going ahead. We have to make sure we have the reimbursement rates, and we have to look towards opportunities to collaborate to make sure we maintain this service going ahead.
I would fully agree with you. So let's keep the advocacy going forward, right? Rural hospitals that are listening to this today, or any hospital, Medicaid impacts all size hospitals. We see the predominance of that in rural communities because of the percentage. But at the end of the day, it impacts everyone because if we were to lose our hospital, that population would shift to the larger tertiary center, and they probably wouldn't even be able to take care of that population based on those numbers. And so this is an issue we have to keep in front of our congressional leaders and have the dialogue that there's other things they have to look at instead of cutting reimbursement to hospitals and to private practitioners who are engaged in the business of taking care of the sickest among us in the most ruralist parts of our country. Now, Alan, I want to jump into something else even more controversial. Let's talk about price transparency, right? Because all I hear in the past several years is, a lot of talk at both the state and the congressional level, federal government talking about price transparency. But let's talk about how that impacts hospitals, specifically rural hospitals. Can you give us a quick thumbnail sketch of what that means?
Oh, I sure can. Price transparency is a great political statement, and
It
that
is,
is
isn't it?
the alpha and the omega. I mean, who can be possibly opposed of knowing the prices? But how this actually operates, this is the worst healthcare policy that I've had to deal with in 20 years or 30 years, I would say, even just
Yeah,
simply because how it actually operates, which is it doesn't function. Now, here's the challenge. Both Republicans and Democrats, they're all bought in on this. And President Trump has he's up the ante. He's going to increase enforcements on this.
oh yeah,
It just simply doesn't work. And for all the reasons that you know and everyone else is in healthcare, it doesn't work. I mean, it's just the concept. I mean, I like to shop for a bargain on paper towels and water fillers, and I'll
that's
check
right.
for a great price on someone to paint my house. But I'm not going to go to someone that promises 1995 for a colonoscopy. I mean, that's just no one
Correct.
does that. That's
No.
just foolish. And
Yes.
the only segment that's seen any benefit, and they want to keep doing it, is the health insurers.
Correct.
They are using that, but that is not being passed on anywhere. That's just helping their bottom line, and everyone knows that's what's happening.
That's
It's
right.
not. It's just not a tool for consumers. It just frustrates me.
Frustrates me as well, especially as the hospital that now is tasked with distributing information relative to pricing, and then how is that information even understood and consumed by the consumer? And are we comparing apples to apples? It's not like walking into drugstore A and drugstore B and having one product. Very significant challenges. I think it's a great political talking point, price transparency, but at the end of the day, it in our industry, it is so over the top, and we have to start moving away from that into more concrete issues. That's going to be for a later episode, though, that I'm going to get you
Bring
on.
me back.
Uh,
I got a
I,
lot more to say on that.
I'm going to bring you back, but I wanted to give our listeners a little bit of a peek into the reality of that's just nomenclature and wording that really in our industry needs to be reformed in terms of what we're actually trying to achieve with that. Let's talk about quality and outcomes. Let's talk about the level of care, and let's have those discussions. But price transparency is not one of those. Now, so let's say that rural CEO is listening to this. He's hearing about Medicaid cuts. He's hearing about price transparency. He's hearing about all these challenges. I want to know, where does the CEO, maybe it's a new CEO, maybe it's someone who's like, I'm just new to the business. Where does he start? Should healthcare leadership advocate locally first, nationally? Should they link up with you first and do it in conjunction? How should that work? Give some guidance.
Yeah, well, yes to everything you just said. It might be helpful. What is the role of any organization like NRHA? And we are air traffic controllers when it comes to policy. And that CEO needs to get on the phone and call his member of Congress and talk about these issues, whether it be price transparency or Medicaid. What we do is we just send a message out. This is a good time to call. And when you're calling your member of Congress, we're also going to be sending letters up to Capitol Hill. We're going to be meeting directly with members of Congress. I'm going to be talking with the Farm Bureau, Farmers Union, Rural Electric Cooperative. They're going to be talking about Medicaid as well, too, at the
Yes.
exact same time. We're talking to our partners and our throughout DC and at a national level. What happens is these members of Congress, they hear from everyone all at the same time, and they hear
Hmm.
from media at the same time, and this avalanche moves policy forward.
It does. It sure does.
That is this combined. Pretty soon, it's like everyone's talking about Medicaid. This is a bad idea. I've heard it from everyone. We're not going to do it. But it all starts with that direct communication, and I cannot emphasize how powerful that is. Members of Congress and state elected officials, they look to you. I mean, they don't know healthcare. They look to you. They trust you. They want to know, how is this going to impact? And we've already seen it in the last 3 weeks on some of the reductions to the VA staff and
Yeah. Yeah.
getting out of healthcare a little bit, but where they've actually had constituents contact their senators, and their senators have said, hold on a second. This is actually impacting my community. Let's talk about how this is happening. That's what we want to have happen.
Yeah, and we should stir the hearts and the minds of the people in these rural communities, especially the leadership, the C-suite, as we call them. When they hear numbers like $880 billion coming out of commerce, for when we know that the vast majority of that is Medicaid, and then we hear about other issues like $262 billion in the SNAP program. And we know what food insecurities are in our respective communities. It's an opportunity for us to advocate. But I want to transition a little bit here into our closing, which is the value added of an association like NRHA. And I want to talk about that because as, an individual that came into this industry and had a chance to sit back and interview and work with all the various associations, and we have quite a few of them, right? American Hospital Association, our state associations. But at the end of the day, the work that the NRHA is doing is remarkable. And the work that you're doing in advocacy, and I think legislative affairs, is spot on. I mean, you should be very proud of the work that your team is doing around going to our federal legislators and saying this is harmful to rural America. And you're fighting a fight that's not always popular in that crowd up there in D.C. And it's probably no wonder why you live 2 hours away. You probably have a lot of flat tires. But at the end of the day, your association is doing a phenomenal job at lifting the voice when we can't lift that voice. I can't go to D.C. every day. And yet you can be there and you can central the theme of the message of let's protect our rural hospitals. So what would you say, some value added? I'm a member of NRHA. For the individual listening to it may not participate, talk to us a little bit about what you give back in some of your membership affiliation.
Oh, absolutely. Well, I think you did a great job of summing up the fact that we focus in on rural. It's all rural all the time. Yep. That's what we focus in on. And we have great partnerships. We work so well with the American Hospital Association, Catholic Health, the for-profits, and states as well, too. They know that we are just on rural all the time, all the time.
Yes,
And
you are.
as I mentioned also, really one thing outside of advocacy that we do is we identify best practices. We share those best practices for replication. You've seen one rural community, but where you see successful approaches, we share that. And with the goal of making sure that we elevate and improve healthcare across the U.S. And I'm so proud of the fact that we focus in on that innovation component. And what are the new tricks and tips for delivering high quality healthcare? And what's making some hospitals successful in light of all of these enormous obstacles facing? So between the education, the networking, and the advocacy, we're your partner to make sure you can deliver healthcare at a high quality.
Absolutely. Training programs, plenty of opportunity for that. Online, even. Opportunities to join your grassroots call, it's called. And I love the grassroots calls. Those are so important because we get to hear about the things that are happening that impact us out here in, what we would say the most remote areas of our country. And so it's just great the work that you're doing. And Alan, I just can't congratulate you enough and thank you enough for the work of lifting up our voice. And this is the time, we know there's a Bible passage that says, for such a time as this. And I firmly believe for such a time as this, you and your team have been called to defend our rural hospitals and our rural health care in this country because the stakes have never been higher. And these cuts cannot be sustained. We cannot see any more closures of obstetric units. It's going to have lasting and far-reaching impact to the health and wellness of moms and babies if we have more of these closures. Psychiatric hospitals and psych units closing because of lack of payment. It's going to only impact those patients who are going to end up in the ER and are going to end up in jail. And we see that. And so there's never been a time that I can say in my time in this industry when for such a time as this, we need to stand up tall and let our voice be heard. And the way that we do it is through the NRHA and other associations. So I want to thank you for that work that you have been doing. It is certainly noble of you and your team.
Oh, I really appreciate it. Thank you for those. I can't wait to share that back with my team as well, too. Love to hear
Absolutely.
it and stay involved. We really appreciate your leadership at the national level as well.
So stay involved. And, I want to thank you. You joined us for our kickoff today, and this has been very fun. We've dived into, several subjects that we could spend hours on, which we will in the
Yeah,
future.
yeah.
We just kind of wanted to give a little teaser here for what this program is going to be all about. And what I'd like to do is as we wrap it up today, we're going to start a new closing segment. We used to ask a question about what is most rural, but we really want what's called rural health recommendations. So if I'm a C-suite executive, if I'm a leader listening to this today, what actionable steps can I take today? What's something that you as a leader can give me that I can use? So we're going to ask every guest on the show. We'll ask them to contribute a recommendation of rural life and healthcare. So if you could be and give us a tip for someone new that's working in rural healthcare, or someone maybe in that rural setting, I would like to ask, what is your rural recommendation that you would give someone that's listening today?
Oh, get involved and make your voice heard. Number one, if you can, type in the words rural health online and Google, Yahoo, Bing. Our website is usually one of the first three that pops up. Get on there. You'll get great information, great tips. Get engaged. Make your voice heard. You would be surprised how important and how influential your voice is as a rural practitioner and the difference that makes.
Absolutely. So you heard the recommendation right here from the National Rural Health Association CEO saying, lift your voice. When you lift your voice, you're lifting all of our voices up. And so we thank you for your participation today, Alan. We thank you for your recommendation. And I look forward to having you back on the podcast here to dive into some of these issues that we know are plaguing our rural communities, just like they are here in Hillsdale. And so hopefully we can get you to do that.
Absolutely. Love to come back.
Thank you. And again, thanks to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcasts. Don't forget to check out the latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you're subscribed to the show that you'll never miss one of our episodes. Until next time.